Hi, I'm Paul Fadale. I was born and raised in Buffalo and played a lot of sports. I went to medical school there, and I was lucky enough to, when I got out of medical school, to come to Brown University to do my orthopedic training. From there, I went down to Baltimore to do a sports medicine fellowship and then spent time in Switzerland doing a sports and trauma fellowship. From there, my first job was at the University of Pittsburgh as a young assistant professor in their division of sports medicine, and had a great couple of years there until I was fortunate enough to be appointed chief of sports medicine back here at Brown University almost 20 years ago. My specialty here is sports medicine, and that includes taking care of athletes as young as teenage kids to as old as senior weekend warriors. And in between, we have been taking care of the Providence Bruins since their inception almost 17 years ago, and Brown University Athletics, all 37 teams, for about the past 15 years. So 20 years ago, if you took care of sports medicine injuries, it was the rare pro or the college football player. Nowadays, sports medicine has evolved from literally kids in grammar school all the way up to people who want to ski in their 70s and 80s. My field has exploded in its knowledge and in its scope of what we have to do to take care of these individuals who really feel that they want to live life to the fullest. My specialty in sports is really centered around the knee and the shoulder, and that's always been classic sports medicine. Actually, it was really just the knees when you go back 20-some years ago. These are the joints that seem to take the biggest injury, and so the evolution has been from really using braces and rehabilitation and not being able to fix very much to open surgery, where we started fixing all those damaged tissues, to over the past 10 to 15 years, essentially almost everything we do now in the knee and shoulder is through the arthroscope. And so we have tiny little holes, much less pain, much faster recovery, and we think better results. We try to get to know them because it's not a one-size-fits-all in any of our management. So when you do sports medicine, you really have to understand where that athlete is coming from you, what the parents want, what the children want for maybe their dad. And so you have to work with the family to get realistic goals of just what are we going to do to make them better. It's great for me because, as I said, I see people of all ages and backgrounds, and it makes my job so fascinating to bring most of these people back to a level of enjoyment in their life, be it from pro to just a weekend warrior. We have that elite top 1% athlete that also comes through our doors, and we have the experience to take care of these people. That's the same experience we're going to give to someone in high school who may get injured, who isn't going to be a pro athlete, or someone's dad in his 50s who just wants to ski on the weekend. We try to give everybody our best. So some people come in and say, well, for a professional athlete you would do this. What are you going to do for me? We do the same thing. Everybody gets the cutting edge technology that we can provide them. I go in and see my patients, and for example, the hot subject today still remains anterior cruciate ligament tears. And I said 20 years ago I would come into this office and tell you, we got a problem here, there may not be much we can do, we have to lower our expectations, these are permanent injuries for the rest of your life. Today I walk in that room and I say, although we can't guarantee it, we can get pretty close to giving you a great outcome to get you back competing in sports. And nothing is better in life than watching someone who is suffering or injured have their life turn around, get them back on their feet, and get them going again. If you're going to be a sports medicine physician, you really have to be able to provide cutting-edge health care for every body part in the human body. Well, that's not possible for one doctor to do that. It's absolutely not possible. So the major sports teams have groups like ours take care of those athletes. That's the kind of backup I have as part of University Orthopedics, where I can turn around and there's an expert no matter what it is. So my Bruins athletes are fighting and they hurt their hands. I have several hand surgeons here who can take care of those patients, get them back on the ice, and get them back to the NHL. In order to teach orthopedic surgery, you have to be cutting edge. You have to go to classes, you have to learn, you have to teach, you have to do research. You have to be better than anyone if you're going to teach it to the younger doctors coming out. What are the next success stories to bring a better outcome for ligament surgery or hip replacement or spine surgery? All that research is done here. All the teaching is done here. We have across the board so many cutting edge things that will come out 10 to 20 years from now that we're working on. We're working on the future to bring cures to certain diseases. We have millions of dollars in research for ACL tears and where it's all going regarding arthritis. In the old days, it was not uncommon to say, you had a sports injury, kind of live with it and just be done, and your life would then change from that point on. rarely would that give you a very good outcome. Today, people demand, and surgeons think it is appropriate, that if you've got an injury, try to fix it so that you don't have problems in the future. If you fix it early on, it's more likely you will have a better outcome. So we have many doctors across specialties who will take those patients in, get them fixed, and get them back. That's a better and healthier way of doing it. Don't let those injuries linger on. It's harder for us to fix them. Surgery is very important to get these athletes back. Physical therapy is equally as important to get these athletes back, and families will often make the wrong decision regarding well, I got to go see my doctor, but I don't care who does the physical therapy. Every piece of the equation is important. Like every coach knows, there's no different part of his team that's not as important as the other part. It all has to line up to bring success. And so we are very lucky at University Orthopedics. Not only do we have cutting-edge equipment for the surgery, but we have several sites where patients can go to get the physical therapy that we work with the therapist personally to get them where they need to go. In-house, University Orthopedics has all the elements to guarantee a success. And that's what all the coaches do in all the sports. They have all the special teams. Everything's in-house. They're all ready to go. That team will win.